how I got into healthcare justice was my mom was diagnosed with cancer, breast cancer, and she didn't have insurance. And we were living across the parking lot from each other, and I was her, you know, I was there for her. I was her caretaker in a lot of ways at the time. So she was able to get care at UNC, very good care. But it was what happened afterwards that was the real problem for me. You know, here my mom lost her breast, she lost her hair, she was going through all these things, and every day we would come home and there'd be bills in the mailbox, stacks of bills, threatening to put her in collections, which they ended up doing. So here's a woman that has to work through all of this. She's literally at work after she did chemo in the morning, throwing up into a garbage pail, and then she has to come home to this, to bills, to collections, to worry about financial ruin. And that's what really started me on this journey, because I couldn't get over it, and I just thought it was gross and unfair and immoral. So I started doing research into different options, and that's when I really noticed that we were the only country that didn't really take care of our people in this way. After all my research, I really figured that a single payer system is the best way to go. A lot of people don't know what that is. So a single payer just literally means that we would have a government agency, sort of like the Medicare Medicaid, and in fact, I don't see why it couldn't be the Medicare Medicaid agency, would then be the sole payer responsible for paying for our healthcare costs. That would cut down on administrative costs like exponentially, because not only do the insurance companies have tons of administrators, the hospitals and the medical providers have to also have a lot of administrators to deal with just billing. And some hospitals literally have more administrators than they do providers. Okay, that's a system that's not working. So I am pushing Improved Medicare for All, what I call so. No out-of-pocket costs, so no cost barriers, covers a wide array of services, and covers all of us. It was really funny. I was watching a rally for a certain political candidate, and the guy that was introducing him literally said, Medicare for All, it's from sperm to worm. I just thought that was the funniest thing. So it's like when you're born till you die. And I found this local group that had just started called Healthcare for All, y'all. It was started by this really awesome woman named Katrina, and she has her own horror stories with the healthcare system. And we started meeting, and it was just a wonderful fit for me, because it was people that wanted to get out and do things, and that understood, like I did, that the key to moving this forward is education, education, education. The more people know about this, the more it makes sense to them, the more they support it, the more they'll become advocates for it. We've been able to, do a lot of work to create really awesome resources for people, for just regular folks. And then one of those things, so we created a double-sided fact sheet that is really nice, graphically designed, so it's not just a lot of text, and it sort of lays out the basics behind a single payer system, which, like I said, we're calling Improved Medicare for All. Imagine if we didn't have to worry about monthly premiums, and if we had an accident or if we got an illness. Imagine a world where that's the case, where we wouldn't have to worry about bankruptcy or financial ruin if that happens. It's a different world. First of all, just from a psychological standpoint, it speaks to the fact that our country cares about us. Our country cares about its citizens. That's huge. That's a really big thing. And right now, we have people having to beg for money on GoFundMe campaigns, or die because they can't get their medicine, or suffer unnecessarily because they can't get their medicine. It's not right. So that's why I'm in Healthcare for All, y'all, because I feel like it's my life's mission to educate people. So that's why I do this.